So these are some of the things that we tend to look at. But again, the cells are starved, they're dehydrated, there's electrolyte imbalance, so the person feels like really tired, frustrated, irritable, memory loss. You don't put any muscle mass. You tend to lose a lot of weight, whether you're overweight or underweight. You lose a lot of muscle mass, in particular a lot of visceral proteins from your internal organs, muscle tissue wasting. You can't use carbohydrates, so that's why your body starts using up visceral proteins from organs.
Itself,
yes,
yeah.
Yes, like an auto digestion, almost like a cancer. So what we do is try to make insulin more sensitive. So you increase physical activity, you modulate the carbohydrate intake. You may need to replace insulin, or you may need some medications to make tissue more sensitive to insulin, and you might be able to get them weaned off. But we have to knock it. Pretty much when you move muscle tissue, you increase insulin sensitivity. So when you decrease muscle movement, then you increase resistance and you put more weight. So the fat cell really is being attacked by, it's almost like it's not a dormant cell like we thought. It's almost being attacked by a macrophage, which is a white blood cell, and causes this huge cascade of events of inflammation. And that's what we're very interested in as far as basic science is concerned at the Methodist Hospital Research Institute. So again, I take that basic science that Dr. Shoy and Dr. Wine do with animal models and translate that to community research, behavioral science, and deal with it. And there's been other people have actually written decades ago. Dr. Sears has written a lot about inflammation. But anyway, with that, I'd like to sort of, maybe we could summarize a little bit. If you might have any other questions you want to ask. But other work that I do is, we can create seminars to teach other individuals, other professionals, or patients. I can help doctors or nurses understand how to manage complicated diabetes. I can help them write diabetes prevention type of grants or management grants.
Can we talk about the glycemic index a little bit?
Yes.
And the lack of knowledge in the public sector, and even physician level, a lot of, I don't know, maybe how it's been possibly a lot of lack of education, and how diabetic situations can be controlled if people just get educated and know a little bit about glycemic index, choices between better foods and so forth.
Yeah, just to make it simple, glycemic index rises in relationship to liquefying something. So if you take an orange, for example, and you take the juice, you're almost at opposite glycemic indices. So eat an orange, you don't absorb that carbohydrate right away because you have to digest the fiber associated with it, and your postprandial blood sugar, that is your blood sugar that after you eat, doesn't rise as high. So you take the juice, however, and you drink it, it's almost like injecting sugar straight in because your blood sugar rises significantly. You have this huge peak. Well, the reason why these postprandial peaks or these peaks of high blood sugar are really bad for our bodies because they tend to formulate hyperglycemic event, which therefore perpetuates hyperinsulinemia. Hyperinsulinemia perpetuates hypercholesterolemia, atherosclerotic plaque formation, hypertension, and an eventual decompensation of the vasculature. So, and the more you have to produce insulin, you have to produce a lot more insulin for something that's liquefied versus something that has a lot of fiber in it. And the more insulin you produce, the more weight you gain, the hungrier you get, and eventually your body's gonna get exhausted. And if you have a high risk for diabetes, you can tend to push yourself towards the diagnosis of diabetes a lot quicker.
Sure.
So, but maybe we could.
We'd like to invite you to come back again, maybe do 3, 4, 5 minutes, and then what we'll do is we'll edit it. If people ask us for it, you can email it to them.
That'll be great. So. Again, I'm Dr. Evangelina Villagomez with the University of Texas Health Science Center and with the Methodist Hospital Research Institute, and I'd like to help you in any way I can with some of the things that I've had the fortune to understand. And thank you very much for your time. Thank you, Garza.
Where are you from? How do you say it in Spanish?
In Rio Grande.
Okay.
La ciudad de Rio Grande.
There you go.
I'm Spanish speaking also. It's been a pleasure talking to you all today.
Could you say something to our Spanish speakers?
Sí, que no se mortifiquen de su diabetes o de del riesgo de tener diabetes. Aquí estamos para ayudarles, tenemos mucho que ofrecerles, tenemos mucho entendimiento, hay mucho estudio que hemos hecho para entender la diabetes y también la prevención de diabetes, y aquí estamos para ayudarles. Después ponemos el email y también otros teléfonos donde nos puedan contactar. Muchas gracias.
Muchísimas gracias a usted.
A ustedes, gracias.
Thank you very much.